Thank you, Mayor Patterson. We have seen an increase in cases recently in KFL&A. The vast majority of those cases are within the city of Kingston. And as a result, our case counts have been going up. When you get over 10 cases per 100,000 per week at a population level, the government will review and often put you into a higher risk frame. So we will be moving to a yellow risk frame. The good news is, though, even though our case counts are going higher, we don't have anyone in hospital, no impact on the healthcare system to date. Primarily, these are younger people in our community that are getting infected. The Section 22 order is in place because around 50% of our samples right now are variants of concern. So those are a type of COVID-19 that is more infectious, that spreads more quickly, and it really is important for all of us in KFL&A as a result to keep our social circles as small as possible. Otherwise, if you have large social events, you could have super spreading events, and we've seen them across the globe. When they occur, the infection spreads very rapidly in the community. If we want to keep our economy open, keep our schools open, keep our families safe, at this time I'm asking through the Section 22 order and requesting it that you keep to your household. And if you're having a social event, it should be 5 or less, indoors or outdoors. This will only protect us, our economy, our schools, our community from having to go further into lockdown. I think it's prudent. I think it's proportional to the risk. I never like having to put public measures in place. But if you're just watching what's going around Ontario at present, there's a significant rise back in cases. We haven't yet seen a significant impact on the healthcare system, but I think that's coming over the next several weeks. And most modelers have told us beware of the variants of concern. Certainly in England, when the B117 variant became the dominant strain, it did spread rapidly and had a very significant impact on the healthcare system. So that's us locally trying to prevent that from occurring. I will review it on a weekly basis. If we're heading in the right direction, I'm absolutely open to removing it for the city of Kingston. And hopefully, again, keeping our community safe. So we together, as usual, have worked very well to resist the infection coming into our community. I think we can do it again, but it's really going to take every one of us to stay in their small social circle to 5 people or less.
So it's fair to say that this measure is really about preventing something worse that could be coming later, like a lockdown or moving into the red or the gray zone, for example. Is that fair?
That's very fair. I think we're seeing around the province, Thunder Bay just went into a complete lockdown. All their schools are virtual, and they sadly have over 40 people in hospital, 11 in the intensive care unit on ventilators. That's changing day to day there, but they've had to go into a complete lockdown, stay-at-home order. That's a position we don't want to go to. I do want us to have a balanced approach by keeping our economy, our schools, and our community open. The mental, physical, and social well-being is exceptionally important during a pandemic. I know this has been a marathon. We're not across the line yet. We have a ways to go. And in that vein, I'm very happy that our immunization strategy is working very well locally as well.
So, I mean, it's interesting you say that, because it's hard to believe it's been a year that we've been following public health restrictions to slow the spread of COVID-19. And like you said, I know you know that people are getting tired, they're growing weary, but there is this light at the end of the tunnel. So I'm just wondering if we talk about that light at the end of the tunnel, can you give us a quick update on vaccine timelines and what we can expect then in the months to come?
Well, thank you, Mayor. I'm very excited about the immunization strategy locally. We've achieved very good protection of our long-term care patients, essential caregivers, and workers. All patients in the long-term care have been offered their second doses, and that we achieved that over a week ago. So they're protected now. We knew they were vulnerable. We've achieved over 50% of our over 80 population in KFL&A. Which is amazing. We've also, given our pharmacy partners are now immunizing, achieved over 50% of our 60 to 64 population. So as a result, as of Monday, there will be an expansion in the eligibility criteria for vaccination. So those 75 and over can go online at ontario.ca/book vaccine. And get their appointments set up if you're 75 or older. And at our 47 participating local pharmacies, anyone 60 and older can book online or phone participating pharmacy and be offered immunization. So I'm very pleased with the rollout. We're over 15% of our adult population at present, and certainly want that to climb as the risk of this new wave of infection threatens our community.
Well, listen, thanks, Dr. Moore, to you and your whole team for the outstanding work you've been doing throughout this pandemic. And I think you and I can both agree that our community has done a pretty awesome job, too, of just everyone doing their part, trying to follow those public health protocols. And, you know, I heard the phrase earlier today that let's finish strong. So, I mean, if we can get to that light at the end of the tunnel, we can just keep working together to finish strong. That would be awesome to see.
Well, Mayor Patterson, thank you so much. That's a great term. KFLA Strong is our immunization strategy. Immunity through immunization will keep us strong and protect the virus from coming into our community. And I agree. We've had a great response through all of our partnerships, all of our community members. We just have to stay strong, remain vigilant, keep up our best practices. And I do believe we'll get through this current threat as we further protect our community through immunization.
Awesome. Thanks, Dr. Moore. Appreciate your time.
Thank you, Mayor Patterson.